hypertension is a very important risk factor for the development of coronary artery disease. And if the blood pressure goes above 20 millimeters systolic, above that level, or 10 millimeter diastolic, above 90 millimeter of mercury, the risk factor of our development of heart disease increases by 2 times. So it is very important for control of coronary heart disease. Secondly, if you go by the Framingham data, wherefrom we have learned the risk factor concept, the blood pressure above anything above 115 and 70 increases the risk of development of heart disease, and that is present in entire population. Even in Indian population also the risk factor works, as per the recent study called Inter-Heart study, where 1/3 of the patients were Indian patients, and all these study included all the patients who had established coronary heart disease. They are all acute myocardial infarction patients, and in those age group, population attributable risk factor was 18. That means 18% increase if you talk about the development of heart disease, and it increases the development heart disease risk by 4.5 times. And if you lower the blood pressure in that population, there is reduction in the stroke, reduction in brain attack or stroke, reduction in heart attack or acute myocardial infarction, reduction in the renal failure. So it is very important to control the blood pressure in a population and prevent the development of coronary atherosclerosis and coronary heart disease. In a population of Delhi city, the incidence of hypertension is very high, and the prevalence in that population was 40%. So it is very high, since the data which was projected in 2005, it was 5 to 10%, now it is 40%. You can well imagine what is the total risk factor burden of hypertension in our country. So if you want to really lower the mortality of heart disease in our country, we have to really lower the population burden of hypertension. We have to reduce the hypertension by healthy lifestyle, dietary changes and appropriate medications.